world-renowned Spanish surgeon Dr. Diego Rivas reported in a local newspaper, after South Africa, Namibia is the second African country on the continent to perform uniportal video-assisted thoracoscopic surgery. With more insight on this, we are now joined by Dr. Jones Ngama, a cardiothoracic surgeon who was also part of the medical staff. Doctor, thank you for joining us this morning and welcome.
Thank you, Nina. Good morning to you and good morning to my fellow Namibians.
Now, this is a milestone for the Namibian medical fraternity at large. What importance does this lung surgery provide to the Namibian people?
Lung surgery in general is an essential part of medical care. As you know, a lot of people, majority of people, not majority, but a significant number of people suffer from diseases such as tuberculosis, etc., etc. And the sequelae or the effects of tuberculosis leads to lung destruction. And then you have smoking-related illnesses such as lung cancer, etc., etc. And in order for us to cure these diseases, sometimes we need to perform lung surgery. So it is an essential part of thoracic surgery, an essential part of medicine, an essential part of surgery in general. The importance is that a lot of people are having poor qualities of life because of their diseases. They are incapacitated by their diseases. Like the patient that we operated on was coughing blood. And at some point, this patient would have died. And not because he's got a hole in his lung, but he would have drowned in his own blood. So that just highlights why it is so important. Specifically, this technique that was introduced by Dr. Diego Rivas is important because it's a movement towards the future of medicine.
What can you tell us about this world-renowned Spanish surgeon, Dr. Rivas?
Dr. Diego is a generally all-round nice guy. I was fortunate enough to have been invited to one of the training courses by a friend of mine. And upon meeting him, I said, I'm from Namibia, and I was the only person from Africa there. And he took an interest for some reason. And we joked at the dinner table and saying, hey, maybe we can do this in Namibia. And he told me that he's going to perform some surgeries in South Africa. And I said, hey, South Africa and Namibia is just close. Why don't you come? And he gladly accepted. Dr. Diego is a world-renowned surgeon. He's a thoracic surgeon. He learned the minimally invasive thoracic surgery from other people, but he pioneered the technique of doing uniportal VETs. And uniportal means that the surgery is performed through a small incision, just one incision. If maybe I can just quickly show you in the book here, if there's, so it's something like this. If you can zoom into this picture here, okay? This is a small incision through which the surgery is performed. He is the pioneer of this technique, and he has pioneered also, amongst other things, doing surgery in patients who are awake. So he's a world authority in what he does, and it was actually a privilege and an honor to have him here. I was so excited after the surgery, of course, and I told my colleagues that we are privileged to be learning and to watch somebody of this caliber performing this type of surgery.
What other skills did Dr. Diego share while he was here?
I would say throughout my interactions. As a professional, you learn from everybody. And you learn from how they behave. You learn from how they think. You learn from their philosophy. Dr. Diego, in our dealings, has taught me one thing. He said, nothing is impossible. When he was supposed to come to Namibia and there was a lot of obstacles, we thought it was impossible. He said, nothing is impossible. When he pioneered this technique, his philosophy was nothing is impossible. Moving on, going towards the future, he said, nothing is impossible. And he kindly autographed this book for me. And it says here, again, that everything seems, if you can just zoom in here, everything seems impossible until it's done. So he's taught me a lot of other things, but I think this is the important thing, because moving forward into the future, if I think that nothing is impossible, that means I can adopt his techniques. That means I can learn his techniques.
Now, the equipment that was used to perform the surgery is said to have been quite costly.
Yeah.
Is it worth the cost?
Absolutely. When you are innovating, when you are pioneering, the initial investment that you have to put in seems a lot. But with time, the cost is reduced. Why is the cost reduced? You have to get the equipment, you have to get the stacks, you have to get the camera, you have to get the minimally invasive instruments. This all come at a cost, yes. But once you have those equipment, the patient stays shorter in the hospital. So if you go to Katutura or Windhoek Central Hospital, the occupancy is a problem because the hospital is overcrowded. So if the patient can go home the next day, you are reducing costs. If a patient doesn't need to keep the drain for a long time, you are reducing costs. If a patient uses less medication because they have less pain, you are reducing cost. The patient does not go to the intensive care unit, then you are reducing cost. So all in all, you need to see the bigger picture. And I think as administrators and as people who are managing these resources need to think long term. We need to improve medicine in general. It comes at a slight cost or a minimal cost of investing in certain types of equipment.
Now, I understand that you had the opportunity to remove the left lung. Talk to us about this.
It was actually the right lung.
The right lung.
This gentleman had multi-drug resistant TB in 2009. That resulted in his lung being what we call destroyed. That means it's got holes in it, he's coughing up blood, and it's neither functionally nor physiologically very active. And it's endangering him, as I said before, that he could drown in his own blood. And so the whole entire lung had to come out. In thoracic surgery, in lung surgery per se, the aim is always to try and preserve normal lung. But in this case, we could not preserve any part of his lung because he would have left him with disease. So we had to remove the entire lung. And it was not an easy procedure because Dr. Diego is from Spain, and they are an advanced country. So their patients present much, much earlier. They don't have adhesions. Adhesions is when the lung is stuck or adherent to the chest wall inside. When they present, the majority are having cancer, and therefore they are detected early. When you're performing surgery on those type of patients, it's much easier. It was very challenging for Dr. Diego, as expert as he is, but he managed because the lung was completely stuck, and he had to slowly, slowly cut away the lung to let it fall down. The second challenge was, because the lung was diseased, a lung is like a sponge. It should be able to collapse. This lung was not collapsing, and it was a challenge to remove it outside from this small incision. But we managed, and so kudos to Dr. Diego, and well done to him.
What quality of life does a patient have after they've had a lung removed? Do you continue as normal, or are there definitely some precautions that needs to be taken going forward?
Most definitely, there are a lot of precautions that need to be taken. What we do is prior to removing the lung, we do what we call lung function tests. So that determines how good your lung physiologically are and what contribution each lung is making to your breathing, to your taking in oxygen into your blood. And if, say, the right lung is contributing 50% and this one is 50%, now this one is diseased, so its contribution decreases. So say it's contributing 15% and this one contributes to the majority of your oxygenation. It means that, and we work out after the operation, how is your lung function going to be, the residual or post-operative predicted lung function test is going to be. And we can say, okay, fine, this patient, we can safely remove the lung and he can live with one lung. A person can live with one lung. The precautions that one need to take is that you should stay away from any noxious stimuli, any smoke, if you are allergic, stay away from those allergies. If you have a flu or a pneumonia, get early treatment. You may need chest physiotherapy to just improve your lung functions. You need to come for regular checkups. But it's like the kidneys. You've got two of them, and you can live with one lung.
All right. Well, yeah. Dr. Ngama, thank you so much for joining us this morning and speaking to us.
Thank you very much. I would just like to say this visit and this surgery was made possible by a few people, and I want to mention them. One is Mr. Raul Eekhout. He's a friend of mine that I met somewhere in the world. from Spain, but he lives in the Netherlands. And he's the one who actually called me and said, I know this guy who's doing this surgery. Come for the training. The second person is Mr. Mark Monell. He's an industry representative who facilitated, together with Raul, Dr. Diego's visit in Namibia. The third person is the Honorable Deputy Minister, Julieta Kavetuna. She, in a short period of time, assisted sorting out the bureaucracy so that they could come. And I really I'm going to clap for them. For the cardiac team, from the junior doctors to the sisters, Sister Blom, all of them were wonderful. And then finally, the hospital administration. So thank you all very, very, very much. You've made history, and I think you should bask in the moment and feel proud of yourselves. Thank you very much.
Definitely. Thank you so much.
Okay.
Well, there you have it. That was cardiothoracic surgeon Dr. Johnson Gama speaking to us about the new lung surgery that was performed in Namibia with the team here making history in the country. We'll be back shortly.